On this episode of the Ask Mike Reinold Show, we talk about how to manage persistent swelling after ACL reconstruction.
The Ask Mike Reinold Show. Helping people feel better, move better, and perform better.
Before we get to the podcast, I wanted to make sure you knew about my free online course on the introduction to performance therapy and training. If you want to learn how to get started optimizing and enhancing performance, this is the course for you. Head to mikereinold.com/performance to sign up today. Welcome back, everybody, to the latest episode of the Ask Mike Reinold Show. We are here at Champion PT Performance answering your questions. Anything you want to talk about, sports PT, performance, career advice, we're here for you. Just head to mikereinold.com and click on that podcast link, and you can ask us a question that we will answer on a future episode. Let's see, today we have Kevin Coughlin, Dave Tilley, Anthony Vedetto, Lenny Macrina, Lisa Lowe, Dan Pope here, all from Champion, all answering your questions again. And other than students, I'm actually going to read the question today. So I don't know if that's good or bad. I don't know if people are fast forwarding, right? You think people just fast forward for 2 minutes for each episode because they get used to our banter at the beginning? What do you guys think?
Minimalist. They just want to get right to the meat and potatoes.
Right. I don't blame them. We're easing into it, right?
I skip ads on every podcast I ever listen to. So,
like somebody skipping us right now.
Yeah, somebody just skipped this right now. You just missed a really awesome point of the episode. Anyway, all right. So for today's question, this is a good question, I thought. This is from David from Glasgow, Scotland. I'm seeking advice on managing persistent swelling following ACL reconstruction. I have a client that's now approaching 5 months post-op. Still has a grade 1 on a sweep test, but is eager to begin running. Okay, so that's one point of the question. So he has persistent swelling, grade 1 sweep, wants to keep running. The other issue that he talks about in his question here is that he says his LSI is around 60%. So he's wondering if he should start running with a little bit of swelling, 60% LSI, and it's 5 months, right? So I think that's a good question, but then he brings up a good secondary one I wanted to get to here is clarification on LSI, because he says he's 60% when compared to his preoperative testing, but because his unaffected leg is so much stronger now, his current LSI is actually 35% compared to the other side. So those are low numbers, right? I think you'd argue the 60s low numbers too. So let's talk about this. What do you guys think? We got persistent swelling. We have low LSI. I'd love to hear your thoughts. Is this person ready to run? What do you think, Dave?
Yeah, the first thing that came to my mind when I heard the question is, I think it sounds like this person is chronically having some issues with regaining strength because of the swelling and the pain and like AMI maybe. So it sounds like, we've been talking a lot about inhibition and stuff like that has like maybe some neural pieces, maybe some pain related pieces. But my gut is that his strength testing is not accurate because it's still a little swollen. It's still a little painful. And the quad is not really working as well as it should be. And so that was what came to my mind first, was like, maybe that those numbers are really low because there's some like, I don't know, baseline level things that haven't been addressed first. And it's like, you're not getting accurate data on his strength because maybe he can't load or because the quad is inhibited a bit. So that's kind of my first thought. And the second thought was like, running is just hopping on one leg, right? That's kind of what Kevin has always told us. So like the forces of hopping on one leg, if you have a couple things in the background that are not maybe smoothed out first, I don't think you're going to, tear something or, hurt something, but you're just setting yourself up for a sore knee, in my opinion. So that's like what I kind of just thought off the top of my head, but
yeah, and I'd add too, like, I'm always amazed that when you have a crazy deficit in strength, but there's obvious things like swelling going on, that if you give it a couple of weeks, you quiet it down and you retest their strength and you see such a large jump, it's like, they don't go up 20% in strength in a couple of weeks, right? It's just that you take away whatever's perhaps inhibiting it, which is kind of cool. So I couldn't agree more, Dave. So that sounds good. Kev, what do you think?
Yeah, I think to your point about quieting the knee down, I would just wonder if has this patient had persistent swelling since the surgery, or was there a time when the knee was quiet and then as they're introducing new exercises, the patient's not responding well? Because that definitely happens where you're in those transition points where, you're going from mostly in the clinic on the table to into the gym. Sometimes exercises don't sit so well off the bat. or that transition from kind of gym-based exercises to adding in plyometrics and agility. So I wonder if there was like an inciting event where a new addition of an exercise was aggravating the person's knee. And then you kind of just would backtrack, I think, to that previous phase and try to calm it down and then continue to progress appropriately. So I definitely want to figure that out and try to, like you said, definitely quiet the knee down first before pushing through. And then I think in terms of LSI, it's obviously great to have those pre-op numbers, but I think I mean, like 60% and those symptoms were probably still not running. But, when you look at a 35% symmetry, that's really bad. And I think if you start running with that, you're going to either, you're going to definitely, the knee's going to feel terrible or something else isn't going to go right. So, I wouldn't rush into it. I think not to get suckered into the time-based progressions and just try to get back to looking at the function and hitting that criteria.
I love it. Yeah. And I think that's a great lesson for a lot of people. Time-based protocols are real and very important, but you could argue they're almost like this is the earliest you can begin something. Doesn't mean you have to begin something at that date, right? It's more of a pace car of okay, the biological healing process may allow you to start running and jumping right now, but that doesn't mean your knee is ready for it. Right. So that's some things that people sometimes, don't quite understand. So I think that's good. What else? Dan, what do you think? I'd love to hear your thoughts. And then maybe Anthony and Lenny. I'd love to get, at least everybody's on here. I got to see all the squares on here. I want to get people's thoughts on what they would do with this person.
I think these are tough patients, and I think that we probably see them more often than we'd like. I can't tell you the amount of patients I've had year out, even sometimes 2 years out. They still get swelling. It just pops up here and there. It's unfortunate, and obviously, we want to get this down as much as we can. But I think it's maybe just part of the game sometimes. I think the more concerning part, which everyone's saying, is the strength is incredibly low, right? Obviously, want to see that a little bit higher, and I wouldn't get this person running until you see them a little bit, maybe closer to 70 or 80%. But in terms of the swelling, I would ask some questions about what the rest of the day is like. Is this individual spending a ton of time on their feet? Are they doing a lot of walking? What's their step count throughout the course of the day? Are they doing anything to manage the swelling? Do they have anything over top of the knee? Are they trying their best to try to get the swelling out? Or they just kind of, at this point, gave up on those things just because they're 5 months out? I would look at their program. I think sometimes when we're doing our strengthening, we think about strengthening as like safe, and then like plyometrics is not safe until we have like a quiet knee. But you can certainly make a knee swollen by doing too much from a strength perspective. So I'd just take a look at the strengthening program and say, hey, do you think anything in here is aggravating? Do we need to cut back on some of the more aggressive strengthening? Can we get some of that strength via, let's say, blood flow restriction training at this point? I know that eventually we like to move away from blood flow restriction training, but maybe that's a good option for now to keep building some strength without aggravating that. I think those were kind of my main ones without, giving too much information, stealing other people's thunder.
I love it. Anthony, what do you got?
Yeah, I was kind of gonna say exactly what Dan was saying.
Got
If
him.
if we're in the gym all the time, right, and we keep aggravating the knee, well, maybe we need to take away some of the aggravating factors, right? So maybe BFR, NMES might be, a scale back that we can utilize to help reduce some of the swelling in the knee, quiet it down, and then we can progress from there. I also think if we start doing plyometrics or any type of running, I think we're just going to continue to make this matter worse. Quad strength is so low. I think that's just going to increase swelling overall. So I don't think that's the right way to go. I think we might have to scale back, like Dan was saying, and then kind of reassess from there.
Yeah, I kind of feel bad because I feel like this patient was probably told at X month they can do X, right? So they have, I don't, maybe unrealistic expectations is maybe the wrong word, but you know what I mean. Like they had their heart set on this, and if it doesn't happen at 5 months, they think they're going to be behind when, they don't understand that this quad and that swelling is probably their like rate limiting factor. So you got to kind of like put all that together. So Len, question for you. Although I just muted you, but question for you. Um, what's the statistical probability that this person's meniscus and articular cartilage looks amazing after this ACL? Do you think that maybe this person was just a little beat up? Maybe is there a chance? Like, why does somebody swell for 5 months, assuming that we're not pushing things like that sort of thing? Like, I don't know. What do you think? Like, I feel like you see this a lot.
I do. Excuse the bingo in the background if you're hearing music. My son has decided to follow me around. Anyway, um, Yeah, I think it's more than we think. I see this a lot. The swelling doesn't worry me as much. I just see persistent swelling. Maybe my people I work with swell a lot. Um, I don't know, but the swelling I think is just a product of the of probably a bone bruise or if there's some kind of cartilage issue going on. So not concerned with that as much. I mean, I am. If it was like a 2+, definitely 1+. Questionable if it's 1+ or trace. I'd want to know if they're doing plyometrics and had they been doing plyometrics leading up to this to kind of some pogo, some basic stuff, some box jumps, and then other stuff to see how the knee responded versus just jumping into a running program. But like everybody else has said, I wouldn't start running. That 2017 paper, I think it was 2007, the Delaware paper that came out, the Epic paper that showed the pre-op strengthening. I'm surprised, this doesn't happen more with people because people come in, a lot of people come in not as conditioned as we can get them with working out 2 to 3 times a week. You get the 16-year-old who's never trained or the 40-year-old mom or dad who hasn't trained as much as we just made them train for the past few months. So they get stronger than their pre-op levels. We take pre-op numbers on their uninvolved side and at least use that as a gauge. That's the minimum. But most people blow through that and get stronger over a quick period of time. And so I usually have to compare current leg to uninvolved leg most times. And the 60% or the 35% is, 60% I'm not as worried about as much. 70 would be ideal. That's kind of the number that I use. But I think we need to maybe give it a little bit more time, get more plyos involved, maybe relook at the strengthening program and go from there. It's a long-winded answer, but definitely probably a bone bruise. I think this studies that show almost 100% of ACL injuries have a bone bruise associated. I think that lingering swelling is from that, I would guess.
Yeah, and I was gonna make that comment that it's common to be swollen. And I think that was the point. That's why I want to get Lenny's feedback on that. It's common to be swollen, right? Especially to have a mild persistent one. You're not talking about the guy that blows up and then takes a few days to come down. I think that's different, right? This is a mild persistent swelling. It is a little different when you think of it that way. So I'm glad Lenny mentioned it with LSI because, that was the last bit of the question here is just because their knee was crappy 5 months ago doesn't mean that we want to aspire to be as crappy as he was 5 months ago. That would be my summary of that, right? Is they're in a much better place now. Their other leg's probably in a good spot. That's what you want to shoot for. So I wouldn't do LSI from their crappy pre-op numbers. Maybe that's why they tore their ACL, right? Because they were so deconditioned. So I'll think about that. So the only thing else, Lisa, we got to have you jump in here. So Lisa, what do you think? Would you run this person right now? The person's begging you, right? You're nicer than me with your patients, I feel like so they I feel like they're begging you. How do you handle the person that's begging you to run when they're not ready? What are some strategies you've done?
I mean, no, I wouldn't let them run right now. I mean, you guys know, I don't really see that many ACLs because you guys all see them. And I get to play substitute teacher. I always say whenever like one of you guys needs like the fill in, which, I mean, I've had honestly, the one person that comes to my head that I'm like, I've had to have this battle with, was more of a middle schooler with terrible numbers and knee pain that I was like bucketing in the really high risk group for getting an ACL tear. And the strategy in talking with her and with her parents was basically like, look, until either we can get pain down a little bit or we can get strength up a little bit, or hopefully both, like you're risking a year of rehab versus a couple of soccer tournaments, and like, which would you rather? And so I feel like I would more just I tend to just paint the worst picture of what might happen and then let them be the one that makes the decision of like, oh yeah, maybe I don't want to do that. I guess I personally don't like people to tell me what to do. So, I like to give the scenario if you go back at this and we could be back where we started from here. And
it's not your job to say what
I don't
they can
like,
or
yeah,
can't
I'm
do.
not, I don't know. I mean, like, I wouldn't suggest that somebody runs with those numbers.
Right.
But let them understand their risk, and depending on the age of the person, right? Like if it's a 40, 50 something year old, like recreational runner and they really just can't stand it, like they're an adult, they make that choice. But I feel like you just got to educate them of what their choice is.
I like that. So give them the thought process on what, what's the pros and cons. And then it always comes back to this, right? Data, right? Quantify, right? So here's your numbers now. Here's our typical criteria to run. You're not there yet. So we got something to do. It's not a bad thing, right? There's a fluctuation on who's ready when they start running. But Lenny and I had this conversation yesterday with somebody who was like, you're not supposed to feel good 5 months out of ACL. It's almost weird if you do, right? So like I'd almost rather be you that's like going through this process and still working hard, right? Than the person that doesn't have any pain, that sort of thing. Like sometimes they get back too early and they do too much. So, just stick to the criteria, stick to the objective stuff, and hopefully that helps. So great question, David. I think that was helpful. I think a lot of, good came out of that question, for about, the swelling and the LSI conversation. So thanks for sending that in. If you have anything like that, just head to mikereinold.com, click on that podcast link and fill it out. And please subscribe, Apple Podcasts, Spotify, whatever you listen to, subscribe so you get notifications for the next episode. Thanks so much.